Mr. Speaker and members. Representative McDonald, can you tell me a little bit about why you think it's important that we collect this data in order to understand this issue?
The gentleman from Wright.
Yes, thank you, Representative Murphy. I think it's important to collect this data for many reasons. One, Gillette hospitals and children's hospitals who see these most critical patients, the children, and it's important to separate and identify those children and make sure that the adequate funds are used to make sure that the children are taken care of. So it's for the children, Representative Murphy.
The lady from Ramsey.
Mr. Speaker, thank you. And Representative McDonald, would you yield for another question, please?
He will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative McDonald, it is for the children, that is true, but I'm wondering if you can help us understand, Representative McDonald, how the collection of this data, what data will help us help the children?
The gentleman from Wright.
Well, what this does, basically, let me just read something to you that, of course, as you're aware, Medicare was primarily founded for children's health services. But recently it's been a catch-all for everyone. I think it's very important that we make sure that the children are taken care of, the most critically ill, the sickest of the sick. That's what it's for. So what this does is it identifies the monies, the funds that are necessary to treat those kids. At this point, over 70% of Medicare resources are expanded for various categories of adults. I would like to see a majority of that to the children, not just the adults. And that's why I think it's an important legislation, important bill.